Hello and welcome to today's webinar. I'm Todd Culver, CEO for Encompass Michigan, and this training is a part of our In Touch Safety Series, a workplace safety and health training project that's presented in partnership with MIOSHA's Consultation Education and Training, or CET, division. Encompass Michigan is the statewide network of comprehensive human service providers working together to develop independence and achieve inclusive communities. Our members provide services and supports to individuals with disabilities and other barriers in all 83 counties across Michigan. And the association has a long-standing commitment to supporting our members in providing safe and healthy working environments. And we also have a long-standing partnership with MIOSHA's CET division, which we value highly. Today's topic is personal protective equipment. We'll talk about the MIOSHA standard on PPE. But to begin, I'd like to take a step back and discuss the concept of PPE as it relates to workplace safety overall. MIOSHA's primary workplace safety objective is something called the General Duty Clause. And it says that employers are responsible for maintaining a workplace that's free from any recognized hazards. Now, what does that mean? Well, basically, it means that if you offer somebody a job in Michigan and anything about doing that job can hurt an employee or make them sick, then as an employer, they have to do something about that. They need to respond to that hazard. And there are three categories of response if a hazard is detected. The first and most desirable is to eliminate it. An example I might offer is with chemical safety. If we were evaluating materials for selection in a manufacturing operation and what appeared to be the most effective material had among its ingredients elements that were hazardous or even toxic, then we would do further research and see if we could find an equally effective alternate material and select that one instead, thereby eliminating the hazard present in the originally proposed material and introducing a safer component where that hazard was not present. The second is to contain the hazard and reduce its impact. Sticking with the chemical example, that might be a material that emitted harmful vapors that would irritate an employee's respiratory system. What we could do to contain that hazard is isolate the use of that material in a contained space in a room that had appropriate barriers from other members of the workforce, and introduce a ventilation system that very effectively and efficiently evacuated the vapors from that workspace so that the employee was not exposed to them and thereby didn't encounter the hazard. The third and last line really of defense for employees is to protect them by providing PPE. And if we stick with that example of a material that emits harmful vapors, even within a workroom that had an effective ventilation system, if the level of exposure to those harmful vapors was still above the threshold that was identified as hazardous, then the employer would be responsible for issuing respiratory protection, that type of PPE to this employee, usually a respirator with a cartridge that would remove the elements that would be harmful to the employee, a filtering cartridge, and the employee would thereby be protected. So these three layers of defense: first of all, hazard elimination; second of all, hazard containment. And if those two options are either not viable or not effective enough to protect the employee, that's when PPE is introduced. Now, the MIOSHA standard has several core elements as requirements. The first is a hazard assessment, which is really an evaluation of the workplace to determine if any hazards are present and personal protective equipment should be required. That equipment is then selected, and there's a process to determine that the equipment being identified will be adequate in its levels of protection for the employee. Each employee needs to be trained on how to use the equipment properly so that it can do what it's designed to do, which is protect the health and safety of the individuals who wear it. And lastly, all of these elements need to be documented in writing to demonstrate compliance. We'll talk a little bit in a little bit more detail about each of these elements next. The first is the hazard assessment. And again, employers are required to assess the workplace to determine if hazards that would require the use of PPE are present. And if those hazards are found, employers must select and have affected employees use properly fitted and suitable PPE. The next couple of slides are examples of tools that are published and distributed by MIOSHA that are very helpful to employers to accomplish this hazard assessment in an effective and compliant way. The one that you see on the screen now breaks down hazards by body part affected: eyes, hands, head and feet, even the face, other parts of the body. And it also denotes hearing and breathing hazards. And it's important to note that these hazards can be especially complex, and the protective equipment that's used requires additional steps for research, implementation, and compliance. In fact, both hearing protection and respiratory protection each have their own MIOSHA standard. The next document is also published by MIOSHA. It's a hazard assessment documentation form listing the workstation being evaluated, the hazard source or type that's been identified, the body part that's affected by that hazard, whether or not that hazard would result in a requirement for the use of personal protective equipment, and finally, the type of PPE. Again, very useful tools that MIOSHA distributes to help employers comply with this standard. The next requirement to be reviewed is training. Before requiring an employee to use PPE, an employer must provide training in the following: when PPE is necessary, what type is required. For example, if an operation required the use of gloves, and that were because of the hazard of the presence of sharp objects, the type of glove is important, right? Because we wouldn't want to issue that individual a latex or light duty protective glove for other hazards, but rather one that's heavier duty, that is constructed of material that would adequately protect the employee. So the type, how to wear it properly, the limits of the PPE and what that equipment can protect employees against. And again, gloves are a great example of that in situations where we are cleaning surfaces or perhaps adhering to infection control protocols. Rubber gloves, while they protect the skin from hazards of absorption, certainly wouldn't protect if we were handling sharp object or using cutting tools. So what type, how to wear it, its limits, its proper care, maintenance, and its useful life, and how to dispose of it when its useful life has expired. So again, employees know and are confident of what needs to be done so that this equipment can do what it's designed to do, which is protect their health and safety. And occasionally, training should include any requirements when in the unusual event that sharing of personal protective equipment is required. The next requirement of the standard, or excuse me, what I'm going to do now is go through some common hazards by body part and discuss the types of equipment that could be selected, beginning with head protection. And this primarily has to do with construction environments or sawmills or woodworking operations where there's a risk of falling or flying objects. any other type of harmful contact or exposure that could reach head level. Occasionally, risks from electric shock, chemicals, temperature extremes require the use of head protection. And also, it will need to be issued in the event that hair entanglement is a risk based on the equipment that the employee is operating. For eye and face protection, some of the hazards could include flying objects and particles, molten metal or other liquids such as chemicals, gases or vapors, any type of exposure that puts eye or face at risk or any combination thereof. The most prominent example of this, of course, is safety glasses that are often required, always with side shields. And it's important to note that many prescription glasses are made of a material that would not protect employees from these hazards. And if that's the case, purchasing prescription eyewear, is an option, but it's also perfectly appropriate for the employer to issue protective eyewear that could fit over the prescription glasses. An example of this would be goggles for a splash hazard that would fit over prescription eyeglasses, such as the ones that I'm wearing. And as a note for employees with prescription eyewear, while employers are responsible for assessing the workplace for hazards and issuing PPE in most cases at no cost, there is a bit of an exception relative to prescription eyewear. Employers are not required to buy prescription safety glasses for those who require corrective lenses. There can be an agreement in place between employer and employees for assistance with that purchase, or as I mentioned, the employer could provide the right kind of PPE that could fit over the glasses. The next type of hazard has to do with arm and hand protection. These hazards could include skin absorption of harmful substances or ingredients. And a quick and easy way to check for the presence of these is to review the material safety data sheets for the presence of the word skin in their warnings. Could include chemical or thermal burns, some electrical dangers, and again, when working with sharp objects or cutting tools, the risk of cuts or punctures, as well as general duty to protect from bruises and abrasions. Some of the categories for these gloves could include leather, canvas, or metal mesh. Again, for that those last types of hazards for bruises, cuts, or scrapes. Fabric or coated fabric gloves for general duty, and chemical and liquid resistant gloves if working with hazardous materials or requiring the use of safety protocols surrounding infection control. And lastly, with foot and leg protection, in the presence of heavy objects such as barrels or tools that might roll onto or fall onto the employee's feet, if we're asking folks to work with sharp objects such as nails or spikes that could pierce the soles or uppers of ordinary shoes, and working on or around hot, wet, or slippery surfaces. Most foot and leg protection is designed, such as safety shoes with steel toes, for example, for that heavy object and rollover protection, or the sole on the bottom for sharp objects. But it's also important to remember that the sole of the shoe in general should be suitable to the work surface to make sure that the employee is protected from any slip hazards that are present. With a few exceptions, one of which I mentioned relative to prescription eyewear, employers are obligated to provide this protective equipment at no cost. It's part of their responsibility under the general duty clause. PPE does serve as the employee's last line of defense, and the assessment for hazards, the selection of the right equipment, the training so that employees understand how to use it properly, as well as documentation of all this in writing, is clearly the responsibility of the employer under the MIOSHA standard. but it's the responsibility of the employee to use PPE properly, to take care of it well, so that it does what it's designed to do, which is protect your safety and health. Thanks very much, and be careful out there.